Hi, Floppycatters. Today I have the pleasure of interviewing Dr. Pamela Dragos, and she is, I just asked her how to pronounce her last name, and so she nodded to say, like, I did a good job, which is awesome. Um, she is a licensed veterinarian and has been for 34 years. She's a certified veterinary acupuncturist, a chiropractor, and an herbalist. She also has decades of experience in conventional medicine and surgery. Dr. Dragos is president-elect of the American College of Veterinary Botanical Medicine and treasurer of the International Veterinary Acupuncture Society. She helps pet parents with their furry friends' medical and behavior issues with gentle, holistic treatments. Dr. Dragos offers personalized telehealth consultations for pets with a focus on natural therapies that address the root cause of illness. And her website is drpameladragos.com, which I will link to in the description of this video. Welcome and thank you for being here.
Thank you, Jenny. I'm really happy to be here with you and your group.
Thank you. So how I found you was I have a cat that is, I don't even know if this is how you say it, but is in remission from feline hyperesthesia.
Mm-hmm.
And I'm a part of a feline hyperesthesia group on Facebook that probably I would say 95% of the cats are being conventionally treated. And my guy, I worked with a gal named Pam of Perfectly Holistic to get under control. And I remember like the horror and everything of all of like thinking like this is never going to end. Like the only option is euthanasia or like when he finally naturally dies. So when he got under control, I said to myself, I'm going to stay in that group, even though he's fine, and help others if they want to go after the cause and not just keep treating the problem. And so there was a gal that came in there with her ragdoll cat named Tofu, and she and I started talking, and I shared Charlie's journey with her. Well, she's taken the research and everything that I did and gone way beyond past me. And she found you, I think, through Dr. Judy Morgan's website.
Right.
Yes.
Yeah.
So she was singing your praises, and I said, let me go check this lady out. And then I reached out and asked if you would do an interview. So thank you.
Yep. Oh, you're welcome. Yeah, feline hyperesthesia is a big issue, and conventional medicine just doesn't have a handle on it. Like they really don't even know what causes it.
Yes.
So they throw the anti-seizure drugs and the pain drugs and just throw the pharmacy at them trying to figure out if something will help. But the nice thing about holistic medicine is we think differently about disease. So we have to take that Western hat off and put our holistic hat on and come up with a different kind of diagnosis, a pattern diagnosis based on what's going on in the pet's body. And so feline hyperesthesia is basically liver wind. So there's wind coming from the liver that's frustrated, that is stuck on the surface of the body, causing problems. And so when you address that with natural supplements based on the other issues with the pet, you can actually get it under control with really gentle therapies and not have to resort to the conventional pharmaceuticals.
Yes. Yes. And one of my fears was, what am I going to be dealing with on top of the hyperesthesia? Like what kind of damage are these conventional drugs going to do to his organs over time? So,
absolutely.
Yes.
Yeah, and herbs don't do that. Herbs protect the organs as opposed to hurting them. So they help the body without the side effects that pharmaceuticals have.
Yes, yes, it's a beautiful thing.
Yeah.
Well, so I want to get into that, but maybe we need to back up a little bit and kind of get an idea of your background, because one of the things that was also frustrating for me was finding someone like you that might be able to help me. I mean, it took a lot of, I went to several veterinarians here, several chiropractors, spent thousands and thousands before I finally got good answers. So, and this isn't just for hyperesthesia, I'm talking about any like chronic ailment or frustration. When the pet parent just knows in their gut there's a better way, then I want them to know about someone like you. So,
Absolutely.
so let's start from the beginning. What's your favorite
Okay.
pet and why?
So I don't have a favorite pet.
Okay.
I absolutely love all pets and all animals. Like I would have every single pet there was, and I don't have a favorite. I mean, they're all unique. They have cool personalities. They've got, really neat characters for their species. I mean, it's just fun. I mean, I spend my days watching animals, and if I watch TV, it's like animal documentaries. I just love I love pets, so I don't have a favorite.
Okay. Were
So
you
I mean,
raised
it's a
with
hard
pets or
question.
yeah, yes. Well, for me it's not because it's a cat, but I do respect and love other animals. Were you raised with pets?
Not really. My
Oh,
family was not a big pet family. Like had a little hamster and we had a couple dogs as I was older, but not a lot of pets. But that's literally all I wanted to do since I was born is be with animals. And everyone knew I was going to be a vet before I did.
oh, that's awesome. Uh, so then what did cause you to go into vet school? Did everyone telling you that you wanted that you
It
should?
was it was absolutely just natural for me. Like, as I grew up taking care of animals, whether they were stuffed animals or real animals or wildlife, I grew up doing that on my own. And I just naturally gravitated to veterinary medicine in college and then applied to vet school and got in. I mean, it was natural. It wasn't like a conscious thing. I just did it.
Got it.
There was nothing else I wanted to do, and there still isn't.
Good. So as I read in your bio that I asked you to send me, you started out as a conventional vet. What
Mhm.
caused you to go into more of the herbal holistic stuff?
It was it was a perfect storm. So actually, I was well, I'm still a conventional vet, but I was doing conventional medicine for decades, and I was working for a corporation, and I was really unhappy with where corporate medicine was going. And then I got into a car accident and had a neck injury, and nothing was helping. And my doctor sent me to his friend that was an acupuncturist. And in 3 treatments, I had no pain ever again with my neck. It was amazing. And it just opened my eyes. And so I looked for acupuncture schools for veterinarians, and there were only 2 at the time. So I enrolled in acupuncture school and it opened my world. And so got certified in acupuncture, and then I got certified in herbs because that was cool too. And then I went to chiropractic school, and yeah, I mean, and it was just where I was in life. I was not happy where I was in conventional medicine. And then my injury, it just took me in a whole different path.
Okay. So I have 2 questions from what you said. Number one, you corrected yourself and said, I am still a conventional vet. So can you clarify what you mean by that?
So when I do consultations, I'm basically a second opinion. So I can I know conventional medicine. So there are certain things that you still need conventional medicine for. And so I can pick that out and figure out like what test is missing from a pet's, if they have a chronic illness and nobody can figure out, maybe there's a test that they missed that needs to be done. Or, maybe there is something conventionally that we need to do as far as medication just to kickstart things, and then do the holistic route. So I still consult about conventional medicine because I can do that. I did conventional medicine and surgery for decades, and still keep up on it, as a veterinarian. So I know what's going on.
Okay. And I actually like that a lot, because I do think that there are times when Western medicine can come in and help a lot. So I appreciate that. I like being somewhere in the middle and not, far one way or the other. And then the other thing that you said is I'm not used to a veterinarian also being a chiropractor. To me, it always seems like chiropractors are independent. There's always veterinary acupuncturists, but not a chiropractor with it. So that's really cool.
So a veterinary chiropractor is actually called a medical manipulation practitioner. So that's what we are. Because when you think of chiropractors, you think of like human chiropractors. And we do it more gently. We don't do like the cracking the neck kind of thing. So there is, veterinarians can go into chiropractic or medical manipulation, and learn that. And that's just another tool in our toolbox to help with pets. We do body work, and cats, interestingly enough, kind of like that sometimes, because if they like to be petted and held, you can gently move their joints around and feel the restrictions and then release them, and they appreciate it.
Yes, my cat Charlie definitely does. As you know, I had to cancel our first appointment for this because I had a screw in my tire, but I wanted to get to his chiropractic appointment. So it's very important for him. I mean, sometimes he comes home and sleeps the rest of the day. So I love it. So how do you end up in, like, how did you leave your conventional practice and then start, or did you start integrating the holistic stuff before you left the conventional?
So what I did is I actually quit my corporate job. I got tired of that, and I went into, I worked in emergency medicine. So I worked for an urgent care and did some relief work for emergency medicine, or emergency facilities around the Phoenix metro area. So I was doing emergency medicine kind of at night. And then during the day, I started my own business, my own acupuncture business. So while my acupuncture business was growing during the day, I was surviving financially doing the emergency medicine at night or afternoons.
Okay, man.
Yep. And then, within 2 years, I was so busy in my practice, I just let the emergency medicine go. I didn't have to do it anymore because I had so much business in my holistic practice. It was a done deal. I was on the way.
I would be so pumped to find someone like you in the ER. Pumped. Because I can't tell you, I just dread going to the ER, like thinking about all the things they're gonna pump my cats with. So that would be wonderful. How has telemedicine impacted your practice, and do you foresee it becoming more prevalent in the future?
Well, telemedicine is wonderful because I can reach more people. I mean, I am talking to someone in Norway right now. I have people all over the world that call me to do telemedicine. So that also is good for me because it gives me flexibility, so I can actually travel and still make an impact and still help people.
Yes, I love it. I think it's the coolest. So how do your consults work?
So on my website, drpameladragos.com, I have a button where you just click to order a telehealth consult, and it will take you to my my calendar, and you just pick a date and time. And then once I get that request, I send an email with instructions. So basically I send intake forms, and I request all your pet's medical records because I'm basically a second opinion. And I also have people send me pictures and videos and even a picture or video of the pet's tongue, because I do tongue diagnosis as part of how I figure out what's going on. So I ask for some pretty funny things, but they're really important actually. And then once I get everything, I go through all the records, like with a fine-tooth comb. I go through everything and pick out little things that no one notices. Like your cat gets up at 3 a.m. and does this, and your vet just kind of blows that off because they have no idea. But for me, that means that there's a liver problem, and it might be a conventional one or a holistic one or energetic. So I go through all the records and I send the pet parent a detailed email on what's going on with their pet, what my interpretation is, and then what my recommendations are as far as conventional recommendations if they're indicated, and holistic recommendations. So testing, diet, supplements, herbs, essential oils, whatever I think the pet needs or would benefit from. And then we Zoom for an hour and talk about all the things on the email that I sent and clarify things, and I answer questions. And then afterwards, I send a follow-up email with what we talked about, and I kind of summarize things and then give dosages with what we've decided to do and more detailed instructions. And then I send them the Zoom recording as well. So that's how my consults go. And they're really detailed. I mean, my emails are like 3 pages long with all these things. So it takes an hour to go through all the recommendations.
Yes.
But then I have to boil it down during the consult, because cats especially, you can't give cats 14 different things. And so a lot of times, like with tofu, I had to like scale things back, and I'm like, we can't give tofu 14 things. We're gonna just work on like 2.
I love it.
And you have to pick the 2 things with the most bang for your buck that will help the problem, and because everything else just dilutes it out.
Yes.
So that's why when I Zoom with people and talk to them, you know, we kind of get down to the priorities.
Yes.
So yeah, and so it's really fun, and I look at illness or problems from a different perspective, and it's effective.
Yes. Yeah. Good. I love it. I want this to be the norm in veterinary medicine, so I love it. What sort of pet parents are coming to you? I mean, are these people that have gone to everyone in their city and they can't find and is it a chronic situation, or do you have even just whatever, regular?
I have a mix. Most of the pets have chronic illnesses that conventional medicine has not fixed. You know, they've done everything that the vet knows of and nothing's helped. So that's where I come in. But I also get people that want to do like new puppy and new kitten consults and get their kitten on the right track. They want to talk about vaccines and flea and tick products and spay and neuter and diet and just the basics, and get their pet on the right track. And that's really smart, because all these chronic problems are related to the crap we did when they were young.
Yes, yes, yes. As we were talking, I was thinking, I was like, I wonder if after you have like a specific consult like that, it does it ever hit you like, I know that vet is trying to do the right thing, and I wish that they had the education I had.
Absolutely. It happens all the time.
Yeah.
So the conventional vets are very well-meaning. They think they're helping.
Yes.
They think that, you know, the prescription diets are helping, and they think that, you know, you need to vaccinate with all these things to prevent disease, and you need to prevent the fleas and ticks. And they do it out of the goodness of their heart, because that's what they learned in vet school, and they haven't been exposed to the holistic arena.
Yes. What do you think? I mean, does it take someone getting into a car accident to have to, obviously your story to make that switch? I asked that because, probably 10 years ago, is that right? Yes, 10 years ago, I wanted to feed my cats raw, and we were going to a different veterinarian at the time, and that veterinarian was like, "Oh no, you can't do that." And up until we left that vet probably 4 or 5 years ago, and she was still saying it then. And I feel like maybe it's just because of what I research and I'm around all the time, but I feel like it's becoming more commonplace to look at alternative treatments. So, what do you think holds a vet back, or why they just don't have the time?
Um, that's one of the things, they don't have the time, because they're too busy doing what they know how to do.
Yes.
So they're not looking. So it actually takes someone, and what we find in holistic medicine, so when I go to conferences and I go to the stress and the well-being part of the after conference thing, we find that, or I find that vets who are burned out find holistic medicine and it saves their life.
Oh.
And vets that are just that get sick, I mean, they literally get some chronic disease themselves and find holistic medicine for themselves, and then they do that with pets. So it does take some crazy incident
Yes.
to switch you to holistic medicine. But with our like with the acupuncture society that I'm with, and the herbal association, we're trying to get more into the vet schools, and the vet schools, most of them have holistic clubs or holistic electives that you can take, or at least physical therapy that incorporates acupuncture. So we're getting more people into the vet schools to open the vet students' eyes so that they know about it, and they don't have to go through freaking burnout to find it.
Yes, I love it. That's awesome. If I'm a pet parent and I'm watching this and thinking like, okay, I think I want to do a consult with her, but I don't understand. How can she help make recommendations for my cat if she's not physically feeling them, seeing them? How would you deal with that?
So that's why I request the medical records. So I go through the medical records, and I go through all the exam findings. So I need the doctor's notes. So I rely on your pet's history. And really, your pet will come to me with the diagnosis already for the most part.
Yes.
So
Yes.
I'm dealing with a Western diagnosis, and then I look at it through a different lens, and then address it holistically.
Okay. So I go to an incredible veterinarian who is very open-minded and will work with any other veterinarian. She wants to learn, and she's very, do you find that that's the case, or are you more fighting more of a conventional situation? Or, I mean, do you need to work with somebody's veterinarian?
I don't need to, although I have had pet parents request that I consult with their veterinarian, and I'll do that. So I get on a Zoom with their veterinarian and we talk about things.
Cool.
So if the vet is open to that, I do it.
Okay.
Yeah.
Oh, that would be awesome. Okay, as a holistic vet, how do you address concerns parents have about vaccinating their pets?
So that is a big concern. And I don't do a lot of vaccines. And what I do is basically follow Dr. Jean Dodd's recommendations and do minimal vaccines as babies, and then booster at the 1 year mark, and then do titers or nothing.
Okay.
So I don't do a lot of vaccines because they really can cause more problems than they're helping. And the vaccines basically make them immune for life. And the vaccine companies won't tell you that.
Right.
But you don't need to do all these, every 3-year vaccines.
Yes.
Yeah, so vaccines are important early on just to, get the protection and the immunity, but they're not important later in life.
Did your or Dr. Jean Dodd's recommendations vary depending on where that animal is located?
I think it depends on the risk factors. So
Okay.
inside, outside. Yeah.
Got
And
it.
then, yeah. But with rabies, the rabies vaccine lasts a lifetime.
Yes.
So, that would be your biggest concern with an outdoor cat. And then, things like the feline leukemia vaccine, that can cause more problems than it helps. So I work on supporting the cat's immune system so that they don't get something like feline leukemia.
Yes. Yes. I remember on the one of the most eye-opening things for me about the rabies vaccine was that my 15-pound cat got the same dose as my parents' 90-pound German Shepherd, and that was like, huh, huh, I didn't know that. That's frightening. Can you share a memorable cat case that significantly impacted you?
There are so many kitty cases. I would say one of them is Big Z. So Big Z is still around. He's 19. He's a little orange tabby cat that has the soul of the pet parent's previous cat. So she found somebody that would take the cat that was transitioning, take that cat's soul and put it into Big Z. And Big Z actually has mannerisms from this previous cat. So it's really weird, but very interesting. And Big Z has the most amazing bond with his pet parent. Absolutely amazing. Like, he understands exactly what she's saying all the time. And like, they read each other's minds. It's wild. And so I see Big Z on a regular basis. He comes in about every 3 weeks, and he's got chronic kidney disease and hyperthyroidism, and he's got cutaneous lymphoma. And we've kept all those things under control for the last 5 years I've been seeing him. Everything under control with natural therapies.
Very cool.
Yeah, and he's just an amazing cat. Like, yeah, so that's a really neat one.
You physically see him?
Yes.
Okay.
Yes. So I do see. I'm not taking new patients in my clinic right now. I just have the current patients that I have, and he's one of them.
That's neat.
Yeah.
Have you ever seen what you would say is a miracle that you're like, I don't know why that worked out that way, but I'm glad that it did?
All the time. All the time. I had 2 of them come to mind. Kidney failure in cats and dogs. In conventional medicine, they do not believe that you can do anything to reverse kidney failure. And they don't have anything that they can do to reverse kidney failure. But in holistic medicine, there are actually herbs that will increase circulation in the kidneys and reduce protein deposits. And so scientifically, we've figured out what these herbs actually do to the kidneys, and you can reverse kidney problems. And so that happens a lot. And then they go back to their regular vet and they're like, oh, it's a miracle. We don't know why this has happened. And I'm like, it's the herbs. Okay.
Yeah.
But you have to pick the right ones, because with kidney failure, there are different types of kidney failure in holistic medicine. It's just not one thing like conventional medicine thinks. So you have to do the right combination of herbs in the right order for it to work. Yeah, but that happens a lot, and conventional vets, it boggles their mind that you can literally reverse kidney failure in
Wow.
pets.
Yeah, that's amazing.
Yeah.
And I
And
didn't know
then,
that there were different types of
yeah,
kidney
well,
failure.
in holistic medicine, there is.
Yes,
Yeah.
makes sense.
So there's a deficiency type of kidney failure and an excess type of kidney failure, and you treat them totally differently, and you have to use totally different herbs, and you can't use them at the same time. So yeah, so it takes an herbalist to figure that out to perform those miracles.
Yes. Oh
Yeah,
my goodness.
yeah. And then the other miracles we have are with things like cancer, because herbs can help with cancer, and then acupuncture and energetic medicine can release cancer energetically from the body. And so one of my clients calls me the voodoo doctor, because her dog had hemangiosarcoma and had his spleen or her spleen removed and had metastasis to the liver. And we did acupuncture and herbs, and all the liver mets went away.
Wow.
Yeah.
That's
And
so cool.
she's like, you're the voodoo doctor. We talk about you like that.
I
So
usually think of voodoo as
miracles.
kind of bad, but it sounds like it was a good situation there.
Oh yeah. Yeah.
Yes.
Things you can do amazing things with holistic medicine, energetically and with supplements and herbs, and it happens. It's great.
Do you use muscle testing to figure out which herbs
No,
to? Okay.
no, I don't do that.
Okay.
I'm aware of it, and I actually have people do it for me on me, but I don't do it for pets.
Okay. I'm familiar with that, and that's something that Pam did for my Charlie, and I like the concept of it. And so when you said you have to be careful which herbs you choose, I thought maybe that's what you were referring to, so that's why I asked. What's the biggest challenge you face in your role as a vet?
Biggest challenge is burnout, because we're healers and we're helpers, and we want to help everybody and every pet all the time. And so compassion fatigue is a huge issue in my life and in every vet's life, because that's just who we are. We're helpers, and we do
Yes.
everything for everyone else first before we take care of ourselves. So
Yes.
that's my biggest challenge, is taking care of myself so I can take care of pets and pet parents longer, as best I can.
Yes. Makes sense. I know that veterinary medicine has, if not the highest, one of the highest suicide rates. And yeah.
Yeah.
Like, people have said to me, like, how come you weren't a vet? I'm like, there's no way. No way. Because of all the things that you have to deal with.
It's rigorous. Yeah, it's
Yes. So let's turn that to the positive. What's one of your most rewarding aspects of being a vet?
I absolutely love taking a pet with a chronic illness that no one has been able to figure out, and conventional medicine has just failed, and be able to improve or reverse the problem with really gentle therapies. I mean, I just jump for joy when I'm able to do that.
Yes.
So that's what I love. I love helping pets, and pet parents do things easily and help the pet.
Yes. I would imagine that's very rewarding. What's a very common mistake you see pet parents making?
I think not letting a pet be whatever they are, like not letting a cat be a cat, and kind of squashing those instinctual behaviors, like the predator prey thing, and the scratching and marking and being independent. We make them, we humanize them instead of letting them be a cat. And then that's how a lot of behavioral problems happen, when we're not letting them do what they need to do. So I think that's one of the big things, especially with the behavioral issues. And then the other thing I see is diet, because that's like your gut is 70 to 80% of your immune system. That's where it comes from. And so, feeding kibble and canned food from the get-go, and your cat lives on kibble and canned food, is a recipe for disaster. And so, and then they're addicted to that, and it's hard to reverse that. So starting off with fresh foods will prevent a lot of problems just in itself.
Yes, yes. I actually loved your response about not letting a cat be a cat. And a lot of times, my website, when I started off, because I have ragdolls and have had ragdolls, was mostly ragdoll focused. But over the years, I'm like, a cat is a cat is a cat. It doesn't need to be a specific breed. But I have had so many people write me and say, like, I didn't get a ragdoll cat, I got a whatever, because they rely very heavily on that breed stereotype. And for me, it's like, it's more spiritual based, where I'm like, you're connected with a certain soul, and they're here to teach you. And so just let their personality unfold and see what you can learn, and don't expect them to be a lap cat, or don't expect them to cuddle. So I really appreciated that. And I didn't think about how that would lead to behavioral issues, but that makes sense.
Oh yeah, all the time. Cats get very frustrated, when they can't do what they need to do. And then they take
Yes.
it out on themselves. I mean, I find that even feline hyperesthesia can be related to that.
Oh, behavioral.
Because
Mm.
stress and frustration affect the Chinese liver, and that's where the liver wind comes from, which is what hyperesthesia is in traditional Chinese medicine. So just frustration of not being able to express themselves can lead to that. So you
Okay.
have to do things, you have to help the cat, by giving them independence. And
Yes.
not, because a lot of people, they put an e-collar on the cat, and I'm like, oh
Oh.
my God,
Oh.
stop. That's like
Yes.
torture.
Torture.
And
Torture.
so it just makes the problem worse. And they're like, well, my cat is just, biting his tail and bloody. And I'm like, okay, but don't put them in a carrier, and because people will confine them and put collars on them. And I'm like, oh my God,
No.
it's just compounding the problem. We're not helping with that. If they want to bite their tail, let them. They're probably not going to bite their tail off, but let's do things to help them not want to do that.
Yes. Yes. I have seen that over and over again in that group. And my response to that is, what if you had an itch and
Yeah.
somebody like didn't, yes, you couldn't rub up against the door, you couldn't, you just, like, you
It's
just had
so
to sit there and
frustrating.
feel it.
Yeah.
Awful.
And so it just perpetuates the problem, and then they just sedate them with phenobarbital or gabapentin.
Correct. Yes. Man, I want to post this interview on that group.
There's a better way.
Yeah, there is. There is. Okay, so switching to your career and future, are there any emerging technologies or treatments in veterinary medicine that you find particularly promising?
Um, there are a couple of things that are really interesting right now, and that's the microbiome of the gut. And
Mm,
so we're doing like the fecal transplants and stuff to jumpstart reseeding the gut when pets have leaky gut, and fixing, because that's basically, the leaky gut is the underlying cause of most chronic diseases, whether it's
yes.
skin and hyperesthesia or kidney or cancer. It's the gut and the immune system. So the fecal transplants have really come along with these companies, and that's helping a lot. And it's not fancy, and it's relatively easy to do, but it's making a big impact. So that's a cool one.
Okay. Yes, I'm familiar with it and have done it.
Yeah.
And I agree. It is a great way to jumpstart, especially like in my cats were dry food fed, can fed, got all the vaccines, all of that crap. So they really needed the help.
Yep.
And yes. What do you do? I know that you mentioned that you're doing some programs in veterinary schools now, but do you mentor any younger veterinarians or students?
I don't personally, but through my organization that I'm with, the American College of Veterinary Botanical Medicine, we're basically the go-to for veterinarians and vet students for herbal medicine. So they can come into our website and get answers about herbs and how to use them and what to use. So we try to be a resource. So that's where I'm, helping with the vet students and veterinarians with herbs. And then I used to be a teaching assistant for the acupuncture school and teach acupuncture to the acupuncture students, but I haven't done that in a couple of years.
Okay. I always wonder, like, if somebody's young, and I feel like many of the younger generations aren't turning to traditional medicine as much. So I wondered how someone who's a young veterinarian might be able to learn from someone such as you.
Mhm.
So that was good to know.
We do have mentors. We do have specifically mentors in the American College of Veterinary Botanical Medicine. That you can go on the site and find a mentor, but that's for herbal medicine specifically. So
Okay.
we do that. And then when a veterinarian goes to acupuncture school, you're required to get a mentor, either within the school or on your own in order to be certified. And so they'll help facilitate that. So once you're in these programs, you do get mentored.
Okay. Good. So where do you see the future of veterinary medicine headed in the next decade?
So it's interesting. So right now the future is like this corporate thing is increasing. And I think, your corporate people, because a lot of them aren't vets, think that this is the way to go. So corporate medicine is on the rise. The corporations are buying all the small practices. They're buying the holistic practices, and some of them are even like eliminating the holistic part of it and just turning them conventional, which is terrible and crazy.
Yes.
But they're shooting themselves in the foot because conventional medicine, pet parents aren't happy about it. The vets and the vet techs are not happy. And it's going to backfire on them.
Yes.
So all this high volume, low touch medicine and surgery that's what's happening, and it's going to backfire because what pet parents want is they want their local vet, that actually cares about their individual pet and takes the time to talk to them and knows their family and, does a good physical exam and actually touches their pet. I mean, you go to some of these practices and your pet never gets touched. So, and that's a disservice. So I think we're actually going to see a rise in conventional medicine, and then or the corporate medicine, and it's going to backfire, and we're going to go back to the high touch, low volume. And that's what holistic medicine is. Basically, all your holistic practitioners are like that. They're individual people doing mobile work or in their home offices or telemedicine like me that are just taking the time to talk to people and help them with their pet individually.
Yes. Yeah. The vet that I referenced earlier that we went to for probably the first 11 years of my cat's lives, they end up getting bought by a corporate.
Mm-hmm.
Yeah.
Most of them have.
Yes, sad.
And one of the reasons that is happening is because practice owners can't find a a young vet to buy their practice.
Oh,
And that's another problem we're dealing with in veterinary medicine. The younger vets don't want to own practices and they don't want the responsibility. So these practice owners want to retire. And so the only option they have is selling to a corporation. And most of them don't want to do it. But
yes.
financially that they have to do it to save themselves.
Yes, you're correct. I was told that financial reasons were one of the reasons why they had to go the corporate route. Yes.
Yeah. It's kind of sad.
It's really bad. Well, since we had to reschedule, I have had the opportunity to stalk you a little bit more on Instagram. So I wanted to hear more about valley fever because I know that that is a passion point for you.
Mm-hmm. Yep. So valley fever is a fungal infection in the Southwest United States, and any mammal can get valley fever. It's in the soil, and when it rains, the fungus grows in the soil, and then when it stops raining and it dries out, the fungus kind of breaks up and releases spores into the air, and we all breathe it in. So people get it, dogs get it commonly because they use their noses a lot. Cats get it once in a while, and all mammals can get it. And it can be fatal. It usually causes a respiratory problem first because you inhale the spores and you get a fungal pneumonia. And it's commonly misdiagnosed in people and pets. So I'm trying to bring awareness to valley fever, and I have seen cats with it as well. And they're tricky because, you know, the antifungal drugs that we use are rough. So I have herbal formulas for valley fever that I would use on a cat, and other things to support their immune system. Yeah, so that's a big thing, and it's actually spreading. It used to be just like California, Arizona, New Mexico, and now it's like Texas, Washington State, Utah, Nevada. It's spreading because of climate change, because we're getting drier and hotter.
Oh.
And then with travel, like if you just come to the Southwest, if you travel to California or Arizona, you're exposed to it. And then you may get it, or your pet may get it when you go back to the East Coast, and then they don't even know what it is. So they don't even test for it because it's not on their radar.
Right. Oh, wow.
And so we get a lot of misdiagnoses or undiagnosed, and yeah, it's a big problem. The fungal infections are complicated because even conventionally, there's not a lot they can do for them. I mean, there's like half a dozen antifungals and that's it.
This is really sad news for me because I graduated from the University of New Mexico in Albuquerque, and I mean, one of my absolute favorite things about the Southwest is after it rains, the smell. I mean, it's fantastic. I guess I'm sitting there like valley fever.
It's the fungus. It's all the fungus growing.
Darn it.
It's not, but I mean, it's beautiful here, but the key is to keep your immune system in tip-top shape, and that of your pets, to keep their immune system as healthy as possible, because if your immune system is good, you can be exposed to that and anything else and not get it.
Right. Yes.
So that's really the key, is keeping your immune system healthy with healthy diet, minimal drugs, minimal vaccines, no pesticides, and eliminate all those hormone disruptors in your environment, like the air fresheners and your laundry detergent and the cleaning supplies. I mean, all those things affect your immune system.
Yes.
Yours and your pets.
Yes, they do. My Charlie taught me that with the hyperesthesia, because I had to make all of those changes 2 years ago. And I'm very, very grateful that I did. Now, if I walk into somebody's house, I'm like, whoa, there's a lot of fragrance in here. A lot of fragrance. So yes, it's funny when you get away from it, how noticeable it is.
Yeah.
The other thing that I have been stalking you with are the pigeons. Um, and I actually sent one of your videos to my vet yesterday because my cat Charlie will not at all tolerate acupuncture needles and hasn't for
Mhm.
years.
Mhm.
And so I want to try laser acupuncture on him. And so I
It's
want to,
fabulous.
okay, so can you tell me more about it? So I
Oh my
can,
gosh. I do laser acupuncture on most cats because
okay,
they don't like needles. I've only had, just a few cats that were dog-like and they would tolerate needles. But most cats will not, and especially, little skinny cats with nothing to put a needle in.
yes.
Laser acupuncture. I use the Reimers Jensen acupuncture pen, and it's absolutely fabulous. And it's got different settings for every meridian and all kinds of different patterns. Like there are different ways to do acupuncture and different patterns that we use, and there's a different frequency for each of those. So it's very detailed. But the laser acupuncture works as good as a needle. Like literally, you get the exact same effect. You're just using technology.
Okay.
And a lot of vets that do acupuncture, they like the traditional needles because it's traditional and it's natural. And laser is more like this high-tech thing and energy, and you're messing around with technology and energy. So some of them have kind of a block to it. But there are also acupuncturists that only use laser. Like
Oh.
they don't even use needles.
Mm.
And what I find is that I get the exact same result, whether I use a needle or laser. And so I like to use needles because of that traditional thought about it. But if I have a pet that does not like needles, or even a pet owner who's needle phobic, I've had that happen where I can't pull out a needle because the owner will, or the pet guardian will pass out.
Wow.
Um, and most cats don't tolerate needles. Maybe you can put one, in the head, in GV20. But so I use laser acupuncture because part of the treatment is to make them feel good and not be stressed. And if the needles are stressing them, then that's working against you, and that's affecting the actual treatment if the pet is stressed. So I try to do all my body work without stressing a pet and actually making them happy
Yes.
with anything I do. And so everything I do is very gentle. And if they're not open to it, I don't do it.
Makes sense. So I think my vet has a K laser. She's not going to have that pen. We're going on Tuesday to give it a go. And that,
There are different types. Yeah.
okay. Do you think you need that that acupuncture pen? I mean, if you don't have it,
No,
right? Okay.
no, there are different kinds. There's the K laser. Multi-radiance lasers has a kit where vets can get the tips to put on the laser that do laser acupuncture. So there are all kinds.
Okay. And then I receive acupuncture because I'm going through menopause and it's helping me with my hormones and all that. It's fabulous. I absolutely hate needles, but the results are fabulous. Um, and I know that there is, and I've seen it with my cats and my parents' dog as well, that there's a cook time for the needles. So how does that equate with the laser?
We don't have to use that.
Right. Okay. So
Um, so it depends on, well, it depends on the laser. So for the most part, we're stimulating a point using a frequency that will either stimulate or suppress it. So it's the frequency.
okay.
So the setting that you use on your laser is going to take the place of the timing of it.
Okay. Okay. That makes sense. Well, I'm excited. And thank you for that video on Instagram because she was like, "Okay, I'm game to try it." And I was like, "Yes." So we'll see how it goes.
Good. Yeah,
Yes.
your cat will appreciate that much better.
I agree, because he gets laser after his chiropractic adjustments and loves it. So I think
Yeah.
that he will as well.
Good.
Thank you very, very much. This was
Oh,
super
you're
delightful.
welcome.
And
Thank
I
you.
love your cat shirt.
Thank you.
I should be that, aware and wear those sort of things when I have an interview, but I don't.
Yep, I had to pull out my cat shirt this morning.
Super cute. Okay, so I will include, or is there anything that I didn't ask or mention that you would like to bring up?
I think we talked about my consults and
Yes.
yeah, and that's the biggest thing, because no matter where you are, if you need help with your cat,
Yes.
you have options. There are more options out there than conventional vets know about.
Yes, there are. Yes. And so I was about to say kind of my ending, which was I'll include a link to your website below, and then also I'll include a link to your Instagram with the laser with the pigeons, just because I mentioned it. Uh, and then if there's anything else, I'd be happy to as well.
Absolutely. Yeah, I've got a Facebook, Holistic Vet Consults on Facebook, and also Instagram, Holistic Vet Consults.
Okay. Thank you again.
You're
I hope you
welcome, Jen.
enjoy the rest of your day.
Thank you. You too. Nice talking to you.
Nice talking to you too.